Now, to take us deeper into the opportunities ahead for AI machine learning in public health, please join me in welcoming Samuel Kakraba, Assistant Professor of Biostatistics and Data Science, who will show us how tools are already opening new doors in this field.
Hello, everyone. I'm happy to see all of you at this symposium. So I'll be talking about opportunities with AI and machine learning in public health. There are a lot of opportunities in AI and machine learning in public health. It's already beginning to transform a lot of fields. It's beginning to do a lot of wonderful things that we would have never been able to imagine that will even be accomplished. So a brief introduction about what is machine learning, what is AI. People have different views about it. Well, just think about trying to create machines that will be able to do the intelligent things that human beings do. When you think about it that way, you are thinking of AI. And if you can further have a way that you don't have to necessarily give it explicit instructions, but just give it data and let it learn from the data and do the things you want it to do, then you are talking of machine learning. So machine learning is basically a subfield of AI. So here are some cool things that are happening with machine learning and AI. So for example, early disease detection. We know that detecting disease early is very critical to public health intervention. Most diseases can actually be solved, may actually be treated earlier if we can detect it quicker. So machine learning AI models are now being used to forecast and predict disease ahead of time. It's also enhancing diagnostic accuracy. So think of medical doctors misdiagnosing a medical condition, maybe considering someone who doesn't have cancer to have cancer and subjecting the person to chemotherapy. Think of the pain, think of the expenses that comes with. Well, with machine learning AI models, we are not trying to replace the medical doctors, but we are assisting them to better diagnose these medical conditions. And then when it comes to resource allocation, how do we allocate our resources? We may not have so much resources in the hospital or in our setting, but how do we optimize our resources such that those who really need those resources reach them in a timely manner? Machine learning algorithms have been used in that way. And then also it's driving a lot of new innovation, telehealth. Now you go to hospital, the doctors are already using these algorithms. Their notes are being taken by these algorithms, and these machines are translating to assist them to be able to assist with the diagnosis. So it's already transforming a lot of field. Here are some key applications: disease surveillance and prediction, automated data quality and integration, diagnostics and risk modeling, and then resource optimization, and then communication. These are all core areas that machine learning and AI is actually impacting a lot. So there are numerous examples in real-world setting. For example, here in Tulane, some of the faculty, we've been able to use AI machine learning to help enhance prediction of Alzheimer's disease just using handwriting of patients. So think of how Alzheimer's is being diagnosed. You need a lot of medical technology, you need MRI, you need sophisticated equipment. Can we use things like handwriting to be able to predict maybe if a person is most likely to be diagnosed of Alzheimer's disease? Can we use voice recording of people to predict the likelihood that they are most likely to be classified as people with Parkinson? All of those are ways that we are already using it. And then when it comes to COVID outbreak detection, how do we detect COVID quickly? Machine learning algorithms are all working on that area. In cancer detection too, you have machine learning algorithms that are ongoing on. Here are some future trends that we anticipate, that we hope to see. They are emerging innovations. So for example, AI in telehealth services. So when you have these virtual assistants that assist with medical scheduling, for example, consultation with medical doctors, those are all ways that AI is being used in telehealth services. And then social vulnerability mapping. So AI mapping targets equitable health interventions for vulnerable and high-risk populations. They are using them in all of these ways. When it comes to GIS and deep learning integration, if we combine GIS with deep learning, it enables precise spatial modeling for localized health intervention. So we don't want to think of machine learning as just something small, but it's already out there and it's breaking new boundaries. There are some ethical considerations that I would like to highlight as we deal with machine learning. For example, just as nobody wants their data just put out there, there are some regulations that needs to be in place. So we need robust oversight when we are using some of these tools or some of these algorithms. And there should be transparency in decision making. We want to care about privacy. We want to protect people's privacy. And then we want to work hard to mitigate biases. So I often tell my students, junk in, junk out. So if the data set that you are giving to the algorithms is already a data set that is underrepresented or comes from only one particular population, then the likelihood the algorithm will learn, give you a result. But because the data set is not good enough, is not well represented, at the end of the day, it can impact on the outcome and the decision you take. So you want to ensure that there's that mitigation of bias in machine learning algorithms. How about students? What are some opportunities for students? So there are a lot of things that students can do when it comes to AI and machine learning. And interestingly, this afternoon, you see the poster, how some of our students are already using machine learning and AI in some of their research work. For example, there can be hands-on training, coursework, take coursework that are going to give you the rigorous skills you need in machine learning. When it comes to, you can focus on AI, digital, epidemiology, all of those areas are places that students can find things to do. There are fellowships and internships that are actually designated to help students and people. And then there's community partnership and service learning. Some of our students who have done APs have gone on to some of the places, have been able to use some of the skills they've learned in AI, machine learning to actually transition and to help in even policy formulation. So don't think of it as just a small space, but it's something far beyond that. And then students can actually, it enhances and fosters technical expertise and raises awareness of ethical issues in technology. So as you take some of these courses, we talk about ethical consideration, and that can help students to actually think about these when they go on to other work. How about researchers? So we as researchers, we can have interdisciplinary collaboration. AI can allow us to collaborate with more faculty, do more work, and try to see how we can use machine learning and AI to address some of the challenges or solve some of the problems that our colleagues may be dealing with. And then we can also look into assessing real-world data. I was talking to one of the faculty a few minutes ago about the likelihood that we can partner with industries that will have real-life data that we can pilot some of our projects, some of our algorithm we can deploy, we can monitor and see how they really do in real world setting. And we definitely want to care about ethical and policy oversight. And then we want to build trustworthy health systems. The key takeaway I want to emphasize is our goal is not to replace human being. Our goal is to enhance and strengthen what we can do. So don't think of AI as replacing us. It's only coming to help us to do better, give us new opportunities and new ways to think about matters. So at Tulane, in the School of Public Health, there are some initiatives that we've been working on, and as part of the AI committee, here are a few things that we've been looking into. For example, we are developing new courses that will strengthen our data science and our AI programs, such that our students will be well equipped to meet the changing needs of AI when they step out of Tulane. We are also looking into how do we really integrate the research in AI into education. As we talk about, new courses are being developed. For example, we are working on courses like applied machine learning. Most of our students in the School of Public Health need something that they can apply rather than maybe just purely theoretical. Learning just the equations may not get them there, but how do they apply it in epidemiology? How do they apply it in biostatistics? How do they apply it in public specific applications? So we focus on applied courses that can really strengthen their ability to apply these. And then also they engage in research and community collaboration. So we focus more on engaging in research with various communities and various partnerships, whether local or foreign, in order to strengthen our AI initiatives. And then predictive modeling in healthcare is one area that we've done a lot. We've written a lot of papers. We've done a lot of research in how do we use predictive modeling in AI or in healthcare in addressing some of the healthcare outcomes. And then we have vision for smart data future. So we aim to empower students, partners, faculty to innovate and lead the future when AI is actually essential to global health. So key takeaway, while we care about AI integration in public health and we want to ensure that our students, faculty are future ready for the workforce, we also want to take care of the ethical and practical engagement. So you don't want to just deploy algorithm without making sure that you are monitoring it. You want to make sure that as you deploy these machine learning algorithm, you are following all of the various aspects that are required. That is what I have for you. Thank you very much.